It's a diagnosis most Americans likely haven't heard in quite some time: measles. But according to a new CDC report, the disease was on the rise in 2013. As the report reads, some 175 Americans had contracted the disease through November 30th, nearly 3 times the annual average of 60 cases. Despite measles being ruled eliminated in the U.S. 13 years ago, there were reportedly 9 separate outbreaks in the U.S. in 2013. Those mostly occurred in religious communities where vaccines are frowned upon. More than 20 people connected to a Texas megachurch that reportedly preached against vaccinations were infected back in August. And back in March, an Orthodox Jewish community in New York suffered the worst outbreak in 17 years, with nearly 60 infected. In both cases, and 88% of the cases in the U.S. this year, outbreaks were believed to have been caused when an international visitor or an unvaccinated person who had become infected overseas came into contact with unvaccinated people in the U.S. The reasoning behind that? Well, in other parts of the world, measles is still a pretty big problem.
While measles was declared eliminated in this country 13 years ago, it continues to rage in places like Europe, Asia, and Africa, with 20 million cases each and every year.
On an average day, 430 children, 18 every hour, die of measles worldwide.
But the good news is, if you're vaccinated, you're likely safe. As USA Today notes, 98% of those infected this year were unvaccinated. And quoted by The Verge, CDC Director Thomas Frieden agrees, saying this isn't the failure of a vaccine, it's the failure to vaccinate. According to WebMD, measles is a very contagious viral infection that causes a rash all over the body and can lead to problems such as pneumonia, seizures, meningitis, and even death. The first vaccine to prevent measles was approved in the U.S. 50 years ago in 1963. For Newsy, I'm Christina Hartman.